Hey, welcome to our explainer. Today, we're tackling a topic called phimosis. For decades, if you had this condition, surgery was pretty much seen as the only real fix. But what if that's not the whole story? What if there are effective, much less invasive options out there that actually preserve the foreskin? Well, we're going to explore the modern alternatives that are totally changing the conversation around this very common issue. So, let's just get right to the point, the big question. For a tight foreskin, is surgery the one and only answer? Well, the short answer is a resounding no, and we're about to break down exactly why. Okay, so first things first, before we get into treatments, we need to be on the same page. What exactly is phimosis? Let's get a clear, simple understanding of the condition itself. At its most basic, phimosis is when you can't retract the foreskin or the prepuce to expose the head of the penis, which is called the glans. This can be a complete inability to retract it or just a partial one, and it's something urologists see all the time. Now, here's something that's absolutely crucial to understand. For babies and young boys, this is often a totally normal part of growing up. It's not automatically a problem. For the vast, vast majority, it just sorts itself out naturally over time. And the numbers really tell the story here. While it's super common in little kids, the rate drops like a stone as they get older. By the time a boy is 16, it's estimated that only about 1% are still affected by it. So if it's often normal, when does it actually become a medical issue? Well, it's when it starts causing real tangible problems. We're talking about things like a weak or sprained urinary stream, getting infections over and over again, or causing pain and even reduced sensitivity during sex. These aren't just minor annoyances. They can seriously affect someone's quality of life. Okay, so let's say it is a problem that needs fixing. What has the traditional game plan been? For decades, what has been the go-to medical solution? For a very long time, the main and often only surgical answer offered has been circumcision, which, is the complete removal of the foreskin. For many doctors and patients, it was just seen as the definitive fix. End of story. But things are changing. Modern medicine is starting to reframe this. Circumcision is now often described as a radical procedure. It has its own set of risks, and it's an irreversible decision that might just not sit right with a person's cultural, religious, or even just personal beliefs. And those risks aren't insignificant. Some studies show the complication rate is around 4%. That can include things like lasting pain, bleeding, infection, or sometimes the patient just isn't happy with how it looks in the end. It's these factors that have really pushed the medical community to look for better, less invasive options. And that search leads us right to the heart of this whole conversation, the major shift towards treatments that preserve the foreskin. You'll hear the term prepuce preserving, and all that means is trying to fix the problem without removing the foreskin. And honestly, this is a huge deal. It gives people a chance to avoid a surgery that might be unnecessary and is definitely irreversible. So when we talk about non-surgical treatments, we're really looking at two main paths: using special topical creams and using mechanical devices designed specifically to gently stretch the skin. Let's take a look at both. First up, topical corticosteroids. These are basically creams that get applied directly to that tight ring of foreskin. They have anti-inflammatory properties that help the tissue become more elastic and flexible. Usually you do this for about 4 to 8 weeks. Then you have the dilatation devices, which take a more mechanical, hands-on approach. Two of the main players here are Novoglan, which cleverly uses a tiny inflatable balloon to create a really gentle and even stretch, and Phimostop, which uses a series of soft silicone rings that gradually get bigger. So how does something like Novoglan actually work? It's pretty straightforward, really. You place this little deflated balloon just under the tight part of the foreskin. Then you gently inflate it to create a nice, even stretch. You hold that for about 15 to 30 minutes and typically repeat it twice a day for a couple of weeks. And does it work? Well, the results are pretty stunning. A clinical trial on the Novoglan device showed that an incredible 90% of patients had significant improvement in their ability to retract their foreskin after the treatment period. 90%. Now, Phimostop gets to a similar goal, but in a different way. With this method, you retract the foreskin as far as you comfortably can, place the right-sized silicone ring, they call it a tuboid, and then you pull the foreskin back over it. The idea is to wear it for a long time, like 12 hours a day, to provide a really slow, sustained, and gentle stretch. But okay, what if the creams and the devices just don't do the trick? What if surgery really is needed? Well, even then, circumcision isn't the only game in town. there are surgical options now that still prioritize preserving the foreskin.
And that procedure is called a preputoplasty. Now, this is totally different from a circumcision. The surgeon isn't removing the foreskin. Instead, they make a few very precise cuts to release that tight band of tissue, which effectively makes the opening wider.
You see, the difference really comes down to the goal. With circumcision, the goal is tissue removal, and the result is that the glans is always exposed. With preputioplasty, the goal is tissue preservation and reshaping, which means the foreskin still functions naturally. And the data backs this up as a really solid alternative. Study after study shows that preputioplasty gives great results. Patients are overwhelmingly happy with the outcome, and the risk of complications is low. It's a fantastic middle ground for guys who need a surgical solution but don't want to lose their foreskin. So, what's the big takeaway from all this? What does it all mean for you, the patient? Well, it signals a really exciting shift toward a new kind of patient-centered care, one that's built on having information and, most importantly, having choices. So, instead of a single, one-size-fits-all solution, there's now this whole spectrum of alternatives to circumcision. It starts with the simple stuff like gentle daily stretching and steroid creams, moves on to these clever dilatation devices, and even includes foreskin-sparing surgery like preputioplasty. And this brings us to what might be the most important point from the research. Raising awareness and improving understanding of these options is crucial to the delivery of patient-centered care. It's all about empowering people with knowledge so they can make the best decision for themselves. At the end of the day, being informed is the most powerful tool you have. It completely changes the conversation with your doctor. It's no longer just, what's the standard procedure? It's now, what is the right procedure for me? Knowing your options is always the first step. The next is figuring out what conversation you're going to have.